when you speak to somebody, but we're also talking more so about like writing notes, how to be concise. All those things kind of come into play during your rotation. So this exam is designed to see where you are in terms of your comprehension and communication skills, and also test workplace communication in medicine. And it's widely accepted in a lot of different countries and continents. Okay, so I think you guys will mostly have questions regarding the timeline of OET. So OET exam, you can take this exam pretty much during, I would say like end of your course to sometime in your fourth year. I would recommend personally taking it during your fourth year. You can take it, after you take step two. That's when a lot of students tend to take it. Sometimes people will take it after they take comp. It kind of just depends on when you want to take the exam. So one sort of disclaimer to this right now is that Ross is figuring out whether students need to take the exam for the 2027 cycle. So in hopefully in the coming weeks, and you guys should be receiving maybe an email from Ross saying that the OET exam is it has to be you have to take it when you apply for residency, and you have to pass that exam. Now, just keep your eyes out for that. Now, ideally, you want to take the exam before December of the year of your application cycle. So the 2026 cycle ended. So now the next cycle is September 2027. So essentially, when you apply in 2027, you want to have step two done. But your OET exam, you can take that anytime before September 2027 or after September 2027, going all the way up to December of 2027. So make sure, if Ross says that we do need to take it, which I'm pretty sure we do have to take it, just make sure that you are aware of this, that you have to take this exam. Okay, so now how to sign up for this exam. So when it comes to signing up for the OET exam, there's one specific way that Ross really encourages students to sort of do. So they will ask you to apply through the Pathways application. So the Pathways application is just a very simple application where I think you fill out like some demographic information, and then there's some other things you need to fill out. And what will happen is once you finish it, you will be eligible to take the OET exam. So for the OET exam, you have to provide your USMLE ID. So once you've taken step one or step two, you guys will have, I believe it's a 7-digit number or maybe an 8-digit number that you are assigned. So you just have to have that USMLE ID and date of birth. And there are different formats and forms of the exam. So there are exams that can be on paper, and there are exams that are also administered online. So there's the OET at home, which is proctored online. And then if you don't want to do it at home because of distractions and whatnot, you can go to the OET and take it at a testing center. Okay, so now kind of breaking down the test format, there are 4 different sections that you have to be aware of when doing the OET exam. So the first section is listening, second section is reading, the third section is writing profession specific. So this is the third section is the section that I've been told, and by friends, by other mentors, that this is the section that people prepare for the most, because it requires you to know how to format notes and referrals, and they look for a very specific wording and formatting. And the last section is a speaking section. Okay, so now the listening section will be about 45 minutes in length. Essentially, what will happen is there'll be some sort of conversation where you can be, for example, the physician, and there'll be maybe some sort of like patient simulation or something like that. And there'll be sort of dialogues that will be taking place between, those two characters. And you have to listen to those conversations and answer about 42 multiple choice questions in this section. And then the next section is a reading section. So this is about 60 minutes in length. So there'll be medical texts that focus on reading comprehension and finding information. And it's about 42 questions for this section. From what I've heard, the reading section is pretty straightforward. It's not like, if anyone's taken the MCAT, it's not like MCAT level reading comprehension questions. It's more so like, were you able to get the point of the passage? Are you able to identify like a specific thing that they're asking for? And uh, that's essentially what the reading comprehension part is. Okay, now I'm going to focus a little bit more on this section because I feel like this is sort of the area that people are going to have the hardest part in. So the writing section, it will be about 45 minutes. So what essentially you will see is there will be a sort of prompt where there'll be like a case note, or there'll be maybe some sort of HPI or something like that. And it will prompt you to write a referral or a discharge letter. And so when you're preparing for this section, there are certain formats that the graders will look for. So if you don't follow those formats, it doesn't matter what content you've written. You could totally write the right thing, but if you don't format it in the way they want to, you will not pass the section. So there are a lot of resources that you can use to prepare for the section. You can go on I think they're on the OET website, there's like a resource tab, and there are practice exams. There are also note format templates, I believe. I've also heard from other students that there are a lot of YouTube videos that you can go online and you can sort of figure out ways to prep for the OET exam. So that way you get an idea of how to write that particular referral or discharge letter in the format that they're asking for. And then the last one is a speaking section. So this is the shortest section. It's about 20 minutes. So this one is more of a like patient physician simulation of a conversation. And from what I've understood about this section is that they give you a sort of a script, and you have to basically read off the script and you have to speak. And so here you're going to be assessed on communication and linguistic skills. And that way they sort of know how clear you are communicating with the patient or whoever you're simulating the speaking section with. Okay, so this is the OET subtest overview at a glance. So we discussed this more in detail, but the one thing I will say is if you look at the writing section, I don't, I didn't really want to go into the breakdown of how they score, but they score you based off of 6 different things. So just keep that in mind when you're preparing for that section. Okay, so now scoring. So the passing score of OET is a 350 on listening, reading, and speaking. So I think for the writing section, the score threshold is like a little bit lower, but essentially in order to pass the overall exam, you need to get a 350. So if you don't, for example, pass like one of the sections, I believe, the listening, reading, writing, or speaking, you may have to retake the exam. You'll be prompted based off of, what your score report says. There's no limit to retake, or no, there's no limit of retake attempts. So if you don't pass once or twice, you can keep taking it as multiple times until you pass. And the passing results will be uploaded to ECFMG in 3 to 10 business days. So Preparation tips, practice your vocab, listen to accents, like work on your linguistic skills. I know sometimes, like for me personally, I speak pretty quickly and I can, start mumbling and not really enunciating my words. So maybe if you guys have the time, practice with a friend, just listen to the accents, learn how to enunciate certain words, and that way you can do really well on majority of the sections. Practice writing letters, referral notes, and then doing role plays, like I said, super important because the speaking section is the like least time consuming section. So if practice and you're able to understand what the other person is saying and then respond to them in a good manner, you should be able to pass that section with flying colors. And then just final advice, practice regularly, use official materials. So you can definitely use the OET website. They have a lot of practice tests, like I mentioned before, a lot of templates that you guys can read over. And they basically whatever we discussed today, the OET website also has a breakdown of what I said. But I just wanted to break it down to you guys further so that you guys wouldn't be confused on certain timeline information and you're able to understand what the actual exam entails. Um, you can always look at YouTube videos and other supplemental resources to help with mock referral writing. Take the mock test if you're feeling comfortable doing that. The exam, from adding up all the time, should come out to around 3 hours or so. So whenever you guys have the time, if you are, past or if you're done taking step 2 and you really want to get ahead of the game, you can absolutely do that. Or if you are in the end of your course, beginning electives, and you're in your comp stage and you want to take your OET exam, then maybe take a little bit of time to just do the exam and take mock tests. And then, yeah, just stay confident. This test is not meant to make you, or it's not meant to be very complex and tricky. That's kind of a misconception about this exam, that it will kind of like mess certain people up because some people are not native English speakers, right? But the whole point of the exam is they're just trying to assess where you are and how conversational you can be, and also whether you're able to have the adequate comprehension skills needed to be a provider. So just stay calm and confident and you'll do well. Okay, so that's all I have for you guys. The OET exam, it's a pretty straightforward exam, but if you guys have any questions, Kim, Trevina, and I can take them.